When health issues come up, we often treat the symptoms first, but something called functional medicine means going after the underlying cause of the disease and working in partnership, patient and practitioner, to find the very best solutions. Daniel Rasmussen of Pinnacle Integrative Health is here to fill us in. How are you?
I'm well, thank you.
This sounds really good because I think a lot of us feel like with health it's sort of whack-a-mole. Something happens and we try to do that and do this, and then at the end we wonder what's causing all of this. So tell me a bit about functional medicine, what its philosophy means.
Well, first we need to contrast it with conventional care, which is the training in the conventional or standard model is to diagnose a disease and then find a corresponding drug for that disease. And it works well for, acute diseases, emergencies, traumas, infections. But where it's failing is the treatment and resolution of chronic conditions.
Got it.
Which affect over 125 million Americans, and it's getting worse every year. So functional medicine...
Can we stop just there for 1 second, that there are so many of us who are living with chronic conditions, 50% of which I think are lifestyle related as
Absolutely.
well, and we're not really approaching it from that standpoint. So this would affect the quality of life of a lot of people, nearly half the country.
Yeah, absolutely.
Okay, go ahead.
So simply put, functional medicine is a systems-based approach where we find a biological system that has gone into a state of malfunction, diagnosing, finding what that system is, and then treating it. And when we find that that approach resolves the chronic condition, the symptoms resolve as a byproduct of it.
Why are we not already doing this?
That's a good question. It's a matter of...
just the way our system is set up.
I think so. So it provides a great opportunity for us to really look at it in a different way.
So let's talk about what some of these chronic diseases are specifically that we're talking about, and then the range of things that might fall under them.
So the chronic diseases are things like type 2 diabetes, autoimmune conditions, rheumatoid arthritis, Sjogren's. The list can go on and on. And
they may have just this huge array of symptoms that are under that disease. So if we attack that disease, hopefully then the symptoms go away as a result.
Right.
And we're not just treating symptoms. So this, I presume, requires lifestyle changes as well as a change to the way you're approaching your medical care.
Absolutely. It's the only way I've seen that can actually resolve chronic disease patterns long term, indefinitely, is making lifestyle changes. How do we know what lifestyle changes to make? We got to do the correct testing, first step. And so our medical team orders up blood samples, stool samples, hormone testing, genetic testing, and then we put a puzzle piece together that helps us determine why that person has the chronic disease.
So is that set of testing different than what I would get, for example, at my annual exam?
Yeah, we work with laboratories that do what are called functional lab markers, and anything outside an optimal zone we call non-optimal means that person will be exhibiting symptoms which will eventually lead to a chronic pattern. And then we work with teaching and guiding someone through a comprehensive individualized wellness program that focuses on what we try to make it simple as possible. Systematic, step-by-step through what we call the 5 pillars of health. The first one is detoxification and gut health. The second would be customized nutrition by doing proper testing of food allergies and food intolerances. The third would be customized fitness. The fourth would be rebalancing the whole endocrine and hormone system naturally without resorting to hormone replacement therapy. And then the fifth is addressing brain health and rejuvenation of the brain function.
Wow, okay, that got my attention. How do you do that?
Well, a lot of research has shown that the gut and brain connection...
Right, I'm reading about this all the time, that we're learning so much. Explain how that works.
Well, the barriers that protect are in the gut. That's a primary barrier. And when it becomes inflamed and compromised, it becomes more permeable, allowing things into the body that shouldn't get into the bloodstream. That same barrier is what protects our brain, called the blood-brain barrier. When that becomes affected and compromised, the same tissue in the body, in different areas of the body, also becomes compromised, allowing inflammatory particles, things that shouldn't be allowed into the brain area to get up there. Now basically your immune system that protects the brain has to attack those particles, debris, toxins, and it creates inflammation in the brain.
And inflammation is disease-causing, it ages us, it's all sorts of stuff.
Dementia, poor memory, focus.
Can you actually reverse these things?
You can. It takes time. It's not like you take a pill and it suppresses the symptom, but yeah, through lifestyle changes, modifications of behavior, all the 5 pillars of health that we just mentioned earlier, our programs are designed to just coach, guide someone through those steps long enough that it becomes a habit, and the results are seen fairly quickly. When you remove the barriers that are preventing the body from operating in homeostasis, the body just returns back to a state of homeostasis.
To be healthy. So let's talk about patient compliance, because one of the things that I think we're guilty of as patients is we go in, I know I do, I'm sick, I can't be sick, doctor, give me something so I can get back to work or whatever, and we're not as patient as we should be about doing these harder things, exercising more, eating better, all that kind of stuff. So how do you approach people from a psychological, emotional point of view so that they'll buy in and actually do these things?
Well, at first we do our evaluations and we interview our patients potentially to see if it's a good fit. And we've learned over the years that that's the most important step right there, is to just see this is what's going to be involved. You're going to have to make these changes. And are you willing? Are you open-minded? Are you ready to make the changes? Do you have a support team around you to make those changes? And then we do our part, but you have to do your part.
That's so important for us to know, as I think as patients. Acupuncture plays a part in all of this as well, correct?
It does.
Where does it fit in?
Yeah. So a recent study published earlier this year, a double-blind study, very strong evidence for a very specific technique of acupuncture, stimulates the hypothalamus in the brain, which then signals to our stem cells that are concentrated in the fat tissue to come out into the systemic blood circulation and circulate through the body, and those stem cells can detect where inflamed, damaged tissues are, organ repair, tissue repair, remodeling, anti-inflammatory processes. And so when we combine these treatments on a regular basis with the lifestyle modifications and all the 5 pillars of health, our patients are able to see results in a matter of weeks instead of months to years. So
that's amazing. Thank you very much. Appreciate it. To learn more about the role functional medicine can play in your healthcare plan, you can visit Daniel and the team at Pinnacle Integrative Health. I'm sorry, I have so messed this up. It's called pinnacleintegrativehealth.com. That's the website for it. I apologize. We'll be right back. Thank you so much.